Hello and welcome to the second module of the Condom and Lubricant Programming chapter of the MSMIT, a tool that offers practical guidance for implementing comprehensive HIV and STI programs for gay, bisexual and other men who have sex with men. This training is brought to you by MSMGF, the Global Forum on Men Who Have Sex with Men and HIV. In this second module, we present a detailed overview of the steps that comprise effective condom and lubricant programming for MSM, as well as program collaborator roles. After completing this module, you should have a basic understanding of 1. Conditions that support effective condom and lubricant programs. 2. The detailed steps in effective condom and lubricant programming. And 3. The different roles national HIV programs and local implementing organizations serve in condom and lubricant programming. With these goals in mind, let's begin. The programming guidance presented in this chapter and others in this tool reflects a health system strengthening approach. This type of approach works to increase the capacity of local organizations and to leverage local expertise so that comprehensive programs can be led, supported and sustained by the communities they serve. While the steps presented in this module assume local condom and lubricant procurement and supply chain systems are in place, strategies for acquiring and distributing supplies of condoms and lubricants in context where such systems do not exist are also explored. In the last chapter, we established the importance of condom and lubricant programs to effective HIV and STI prevention among MSM. We will turn now to some conditions that support effective condom and lubricant programs. Following this, we will examine program steps in detail. An essential condition for effective comprehensive condom and lubricant programming is strategic partnership formation among all program stakeholders. Depicted here are some examples of the different kinds of organizations that can partner together. Partners should include organizations of men who have sex with men at a minimum, as well as NGOs, community-led organizations, the Ministry of Health or National AIDS Programme, Department of Reproductive Health, United Nations agencies, the private sector, social marketing organizations, donor agencies, lawmakers and law enforcement ministries. In addition to collaboration between partners, here are some of the other conditions that support effective condom and lubricant programming. There should be governmental commitment to collaboration with implementing partners and MSM organizations with coordinated efforts and sound leadership at the national level. Non-governmental agencies or government foreign mission offices should offer channels for improving access to condoms and lubricants when stockouts or sporadic access to commodity deliveries occur. Government-led efforts should be designed in collaboration with MSM users of condom and lubricant. Demand for condoms and lubricants should be created and sustained. Adequate supplies of high-quality condoms and lubricants should be available and distributed widely, and advocacy, skills building and knowledge sharing should be carried out at all levels to ensure the sustainability of the program over time. In countries where homosexuality is criminalized and where local organizations of MSM may be forced to operate covertly due to restrictive laws, accessing condoms and lubricants through ministries of health and other public sources may not be possible. Although condom and lubricant distribution for MSM in these environments is difficult, it is not impossible. Some organizations have found creative ways to meet the critical needs of their constituents within repressive environments. One commonly used strategy is to partner with NGOs already engaged in HIV prevention among the general population, and who have existing procurement and distribution systems in place to expand coverage to MSM. Another approach is to determine which international NGOs or foreign government mission offices are locally involved in condom and lubricant supply chain management, and to identify ways to tap into these sources to improve service delivery. We will now turn to the steps that comprise condom and lubricant programming, which we briefly introduced in the last module. They are 2. 1. Establish accessible condom and lubricant supplies for MSM. 2. Promote male and female condoms and lubricants on multiple levels. And 3. To create an enabling environment for condom and lubricant programming. We will define each of these activities in detail, as well as list examples of activities that both national HIV programs and local implementing agencies can run at their respective level. The first step in effective condom and lubricant programming is to establish accessible condom and lubricant supplies for MSM. The group of steps of this supply process is commonly referred to as a supply chain. Presented here is an overview of some roles national and local implementing organisations can play in the first step. Very broadly, you can see in this schema that national level implementers are in charge of condom and lubricant procurement and distribution, while local agencies are responsible for conducting research, mapping MSM communities and distribution. Both levels are simultaneously responsible for monitoring and evaluation. Listed here are the main components that typically comprise a condom and lubricant supply chain. An effective supply chain ensures that the right quality product in the right quantity and right condition is delivered to the right place at the right time for a reasonable cost. You can see here that a good system ensures product quality, product integrity, and safeguarding during storage, and that the product and distribution plans meet MSM needs. Accurate condom and lubricant supply planning requires forecasts based on regular consumption data, supplemented with data on service provision, demographic and morbidity data, estimates of population mobility and program plans. National condom and lubricant programs should work closely with organisations that serve MSM to request regular reports of condom and lubricant consumption within a specified period. It is important to be aware of the fact that multiple condoms and lubricant sachets may be used during a single sexual encounter. For this reason, asking men who have sex with men about the frequency of their sexual activity may not yield accurate information about the quantity of condoms and lubricant each individual may require. These questions should be framed in a way that accurately captures the number of condoms and lubricant sachets MSM require. Forecasting is a site where government distribution programs and MSM organisations should readily collaborate. Men who have sex with men should be engaged throughout the process of planning and mapping distribution points, as well as engaging in condom and lubricant distribution themselves. Presented here is a list of questions implementing organisations should ask when planning for adequate supplies of condoms and lubricants. Empowering organisations of men who have sex with men to distribute condoms and lubricant to communities is essential to increase their accessibility and use at the community level. Because they have direct access to condom and lubricant recipients, organisations of MSM are key distribution points and can provide condom and lubricants in drop-in centres through community outreach workers and as part of other health services. Condom and lubricant distribution programs should work with MSM to understand their preferences for condoms and lubricants, including material, condom size, colour, scent, flavour and branding preferences. The second step in effective condom and lubricant programming is to conduct multi-level promotion of male and female condoms and lubricants through social marketing programs. Presented here is an overview of some roles national and local implementing organisations can occupy in the second step. Very broadly, for this step you can see that national level implementers are in charge of building the capacity of local organisations to promote condoms at the community level, as well as destigmatising condoms and lubricants in a variety of contexts. Local agencies are responsible for building and conducting community-designed and driven promotional strategies. Social marketing condoms and lubricant is another approach to promotion. Condom and lubricant social marketing programs sell lower-priced, subsidised condoms and lubricants to individuals who can afford to pay only some of the total commodity cost. They also carry out a variety of branded and generic marketing campaigns that destigmatise condom and lubricant use overall. While there are advantages to social marketing programs, they should not be a substitute for the distribution of free condoms and lubricant in sufficient quantities to men who have sex with men. A primary objective of country ownership of HIV prevention, treatment and care programs is to strengthen health systems so that sexual and reproductive health commodities are included as essential medicines in all public health programs and clinical services. By involving the private sector in condom and lubricant distribution, governments can reduce the overall budget needed to procure sufficient condoms and lubricants for free distribution and broaden options for condom and lubricant procurement, distribution or marketing. When the government works with both the public and private sectors simultaneously, it can increase the options for obtaining condoms and lubricants for individuals across all socio-economic levels, and can significantly improve access for MSM. An example of such a collaboration is presented here. Public, private and social marketing sectors can coordinate efforts at the national level to institute a total market approach, or TMA, to condom and lubricant programming. A strong TMA with broad reach emphasizes segmentation of the marketplace, coordination with manufacturers and distributors in the private sector, and development of branding strategies tailored to specific consumer groups. An important part of condom and lubricant promotion is creating demand. Non-judgmental sex-positive and medically accurate communication at the individual, group and community levels is one way to do this. The right kind of information can motivate men who have sex with men to incorporate condoms and lubricant in their sex life. Some examples of the form this communication can take are listed here. Clinic-based and community-based counselling, mass media campaigns, and information communication technology. We will now go through each of these steps in more detail. Behaviour change communication strategies in the form of counselling should be designed to help individuals and groups understand and take charge of their health. This will in turn generate demand for condoms and lubricant. Acknowledging that men practice anal sex because they enjoy it is a necessary precursor to motivating them to care for their health during anal sex. This includes providing basic information about the anatomy of the anus and rectum and their role in sexual pleasure, as well as specific protective anal health practices. A successful strategy incorporates both individual and community interventions. Some potential activities for each are listed here. Individual interventions include one-to-one counselling from healthcare providers and interpersonal communication with community outreach workers. At the community level, group activities can provide opportunities for discussion as well as for making condoms and lubricants available. Condoms and lubricants should also be available and promoted in health centres used by MSM, as well as in MSM-frequented community spaces such as drop-in centres and entertainment venues. Mass media promotion is another way to market condoms and lubricants. Broad social support for condom and lubricant use is needed for them to be used consistently. Condoms and lubricant cannot be stigmatized or viewed as only for high-risk sex or only for MSM. It is essential that social values encourage the acceptance of condom and lubricant use as a sexual health tool in both casual and regular sexual partnerships. Where possible, condom and lubricant promotion programs should expand activities for the general population in order to create overall social support for condom and lubricant use in all types of sexual relationships. Some examples of how media campaigns can help to promote condom and lubricant use, decrease demand for condomless sex, and change social norms are listed here. Campaigns should provide consistent and complementary messaging through mass media, health service providers, and entertainment venues. Ideally, media promotional efforts are delivered through a partnership of organisations, including the national government, relevant NGOs, and private sector condom and lubricant companies. When these partnerships are successful, they create high-quality campaigns that are effective when they reach MSM and the general population. These messages will motivate individuals to use condoms and lubricants while also influencing social norms and normalizing condom and lubricant use among the general population. Information and communication technology, also known as ICT, is a third way to generate demand for condoms and lubricant. As internet access expands, individuals interested in casual and commercial sex often meet online. The anonymity afforded by social networking apps and websites can make them an effective platform for health promotion. Some examples of how ICT can be used to generate demand for condom and lubricant use are presented here. Condom and lubricant promotion programs should expand to online venues, particularly those where commercial and casual sex contacts are made. Social media messaging should reinforce and complement condom and lubricant promotional messages in other mass media and inform individuals about condom and lubricant outlets. Note that online condom and lubricant promotion is most effective within a broader sexual health framework that provides access to other HIV and STI prevention services, such as HIV and STI testing and counselling. Please see Chapter 5 of the MSMIT for more information about ICT and HIV and STI programming. Take a moment to check your understanding. True or false? A single condom and lubricant sachet is required per one sexual encounter. The answer is false. Multiple condoms and lubricant sachets may be used during a single sexual encounter. This is important to bear in mind when forecasting condom and lubricant needs. The third step in effective condom and lubricant programming is to create an enabling environment. Here is an overview of some roles national and local implementing organisations can play in working to create an enabling environment. Very broadly, you can see here that national level implementers are in charge of challenging laws and working to stop obstructionist law enforcement practices, while local agencies are responsible for soliciting programme feedback from the community and conducting advocacy to ensure supportive legal structures are in place. An enabling environment for strong condom and lubricant programming ensures that policy, legal and regulatory frameworks are supportive of condom and lubricant programming. These frameworks are properly enforced, and key organisations and individuals support condom and lubricant programming and access for men who have sex with men. In order to support the most effective HIV and STI prevention programming possible, national governments should establish laws and policies that protect MSM community rights. Condom and lubricant programming should never be an isolated activity. At the local level, community-led condom and lubricant programs can best achieve health promotion goals by working directly with men who have sex with men to understand situations and social factors that compromise condom and lubricant use. For example, drug use, violence, group and casual sex should be addressed by community members who are involved in program planning and development in order to develop effective harm reduction and intervention strategies. Depending upon the local context, either advocacy or programmatic solutions or both could address these situations. Listed here, you will find local-level strategies for creating an enabling environment for condom and lubricant programming. Effective condom and lubricant programming includes advocacy to engage the media in creating an enabling environment. One way to do this is to identify and support condom and lubricant champions within government, civil society, and the healthcare system. A champion can be any individual who rejects laws and regulations that negatively influence condom and lubricant use, and is able and willing to publicly advocate for such laws to be overturned. In some cases, it may be necessary to strengthen the technical and advocacy skills of these champions through training. Training materials on creating an enabling environment can be developed or adapted from existing models. Champions can also be provided with guidance on developing communication strategies to engage the media, and following a train-the-trainer model can facilitate sensitization trainings and skills building for journalists and members of the mass media. Before moving on, please consider the questions presented in this self-check and assess your understanding of the information presented in this module. This brings us to the end of the second module in the Condom and Lubricant Programming chapter of the MSMIT. To review, this module presented conditions that support condom and lubricant programs, the steps involved in running an effective condom and lubricant program, and the various roles national and local program implementers play. In the next module, we will look in detail at other considerations for condom and lube programming, including lubricant-specific program guidance, program management, and monitoring and evaluation.